The City of Toronto is enhancing targeted measures to help the most vulnerable communities in their fight against COVID-19. And this time, buses will be joining the battle. Decommissioned TTC buses that have been converted to mobile testing centers will be up and running in areas that need it most starting tomorrow.
It's just common sense. We want to help the province increase the testing of the right people in the right places at the right time, which is now, so that we can stop the spread of the virus. And we know making these sites as easy as possible to access will help in that regard.
The first two buses will be out in the Rexdale area tomorrow. The buses can test 100 people a shift and will operate in communities where there aren't testing sites nearby. The city will also use existing city facilities to add clinics in neighborhoods facing higher positivity rates. Meanwhile, Toronto's Medical Officer of Health, Dr. Eileen de Villa, is warning that December is a critical period that could make or break the city's fight. She also points out that the highest positivity rate in Toronto, which is 11.6%, is found in people aged 14 to 17. That's 2% higher than the next highest group, 18 to 23-year-olds at 9%. And Brampton remains one of the hardest hit cities, not just in the province, but in the country. Today, Mayor Patrick Brown said while news of the vaccine is encouraging, there are still key tools needed to help keep the city safe. Today, he made an impassioned plea for two measures he says will make a huge difference. They are paid sick days and isolation centers.
I find it infuriating that here we are so far into the pandemic and that we still have workers going to work with symptoms because they can't afford to miss a paycheck, because they have to put food on the table, because they have to pay their rent. Paid sick days is a critical tool we need for our vulnerable essential workers. And some companies have done this on their own, but it needs to be across the board.
And he's still pushing for an isolation center in northeast Brampton to ensure everyone who needs to quarantine is actually able to do so. Meanwhile, Peel's Medical Officer of Health, Dr. Lawrence Lowe, says numbers are still going in the wrong direction. The testing positivity rate is down to 13% from a high of 15%, but that still represents one of the worst positivity rates in the province, although the doctor is hopeful numbers will plateau soon. In Mississauga, Mayor Bonnie Crombie says the next 3 to 6 weeks will be extremely difficult on hospitals as more people are hospitalized and more healthcare workers are infected.
It's real people, our residents, who are dying from this virus. I want you to remember that when we debate restrictions and talk about the unfairness of the lockdown measures. It's easy to lose sight of why we are doing this, but we have to remember we're making these sacrifices to protect our most vulnerable residents.
All three mayors are really encouraging people to order takeout tonight. It is Takeout Wednesday, and they say every little bit helps restaurants who are currently in lockdown zones. Now, as for whether or not lockdown will be extended past the 28-day period, the medical officers of health in both Peel and Toronto say the numbers just aren't where they should be. But either way, their messaging will remain the same throughout the holiday season to limit close contact to households only.